Hello, everyone. Thank you so much for joining us for this October 16th, 2025 Board of Health meeting. I know we have a couple of folks that are going to be joining us in a couple of minutes. Um, Wanted to first note that there are a couple of agenda changes. So in the agenda that was sent out to you all last week, it notes that the department, one of the topics referenced talking about having an in-person meeting. We're moving that to the announcements. And the Board of Health is going to be talking about the third quarter um, update. Um, and I believe those were the edits, if I'm correct, Kristen. Correct? Were those the only two changes? Okay. So with those changes in mind, um, I would like to move forward with the meeting and call roll. Does everyone agree? Okay. All right. When I call your name, please just indicate here or present, please. Okay. Uh-oh. Sorry, folks. My the roll just left my screen. Pardon me, waiting for my email to come back up so I can call the roll and make a note of who is present. All right. Barbara Ludy,
Present.
Brittany Jones,
Present.
Kristen Simpson,
Present.
Deidre Griffith,
Present.
Christopher Daly,
Present.
Colleen McNicholas, Elizabeth Ebert,
Present.
Enval Shakam,
Here.
Melissa Tepe,
Present.
Morgan Shield,
Here.
Nebu Kolancherry.
Present.
All right. Thank you so much. Okay. Well, the first agenda item we have now covered. The next agenda item is for us to approve the September 18th, 2025 Zoom video as our meeting minutes from last month. Do I have a motion?
Motion to approve.
Do I have a second?
Second.
Thank you. All in favor of using our Zoom video as meeting minutes for September 18th, please say aye.
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 If anyone's opposed, please say nay. The motion carries. Thank you. All right. We'll now be moving into our board committee update. Kristen, I will hand this segment over to you.
Okay. Good morning, everyone. So quickly, before we kind of talk about each of the committees, and the committees are Community Engagement Committee, Academic Partnership Committee. The name changes sometimes, so I'll leave it at that. And then Governance Committee are the standing committees that exist on the Board of Health and Hospitals. So before we go into those updates from the chairs or a designated person that the chair has appointed to give those updates, I did want to announce committee assignments for our new board members. For NABU, you will be on the Governance Committee. And so April is the chair of that committee, and you all can connect on when those committee meetings are and share some documents with you that they've been working on thus far. And then Deidre, you will be on the Academic Partnerships Committee. Okay. And that the chair for that committee is Imbo. And you all can connect about when those meetings are and can share where the committee is and what they've been working on thus far. So without further ado, I will transition to have an update from the governance committee first. April, would you like to share an update?
Yes, thank you. When I sent out the board packet to you all last week, you saw that I had attached our current bylaws as well as a version that governance has been drafting. So we've spoken over the past year and a half about the need to look at bylaws which had not been updated since 2017, both to modernize the language, to make some things more clear in terms of our board role and function. And then we found out that we also needed to make sure that we were looking at them in order to be in compliance with Ordinance 71994, which basically asks for every board to have a set of rules that governs how the board works, how the board runs. And so there were a couple of different reasons that we needed to be looking at the bylaws. But the members of the governance committee, now Nebu will be joining us, but it's myself, Colleen, and Chris. And so what we have done, if you have taken a look at the kind of short memo that was attached to the top of it, is that it really highlights the areas that we were focused on making changes to. And so I'm just going to briefly highlight what those areas are. So we really wanted to focus again on achieving clarity on the purpose, process, membership roles, and duties. We wanted to make sure that we altered or changed any gendered old kind of outdated terms, legal terms that or legalese that didn't add to the meaning of the clauses, and then of course ensuring that we were meeting the needs of Ordinance 71994. So you all just got this on October 10th, and don't know if folks have really had a chance to process both the existing bylaws and the changes that we are currently working through. But what we would like to do is offer a feedback session for those who would like to meet and talk through some of the changes that have been made so far. And we would also ask that if anyone is not able to attend or doesn't want to attend kind of a virtual meetup to talk about these changes, that you please send some feedback to us. Our goal is that we get these rules approved by the deadline that has been set, which is October 31st. And a special meeting may be called if it's possible to schedule it with enough members prior to that date in order to vote on this matter. But that's a TBD. It depends largely on feedback that we get from folks in terms of whether you think the changes that have been made are aligned with the purpose, process, membership roles, and duties that you also feel our board should be following. Also, in the document that has the newer version, you would have also seen Appendix A, which had another list with some clarity around any reasons a member might be asked to leave the board. And also some language around what the motion might read as when we do vote to actually approve any new version. And the motion would read at this current time, approve the revised bylaws, including Appendix A as presented if the motion passes. The revised bylaws will take effect immediately. If the motion does not pass, the existing bylaws will remain in effect. So that is a summary of what we have been working on in governance. That has been the largest part of the work. So I will open it up for anyone else on the governance committee to offer feedback on the process or on some of the changes that we've been talking through. It's been a tremendous amount of work, and I thank all of our members for just really digging into this process. But if you all have some other comments that you think are pertinent, I'll have you share them before opening this up to any questions from the board. All right, hearing none. Are there any questions from members of the board about either document, existing bylaws, or what we have been working on? And also willingness to meet to talk through any changes next week.
April, super willing to meet. And if I'm overstepping right now, please let me know. I did have a question on some of the language. So it says 3 members of the board shall be regularly licensed practitioners of medicine or surgery. Is that a requirement, or is that something that the was
Yes, it
proposed by
is
the group?
currently language that is in the city charter. So let me back up and say, I did have a conversation with the city councilor's office, both about the existing version and the changes that you see in the current version. We know that our city charter isn't relevant for how the Department of Public Health works in all ways at this time. For instance, our city no longer runs hospitals, and yet there are references to hospitals and having people on the board specifically to oversee their management. And so the guidance that we were given was for anything that is still possible to maintain and that is still relevant, to keep it in, keep that language and work with the rest. So that is what we try to do. And I will note that we do have on this board at this time 3 licensed medical doctors. We also have a doctor of chiropractic, Dr. Daly.
My only few questions about the bylaws and the charter. As we know, the charter is very much outdated since 1958. I was wondering if we can possibly, just for the full board to think about possibly just looking into that. And then also for the removal section, since we don't have power to remove a board member, does it make sense to have the appendix on there? And just seeing like what is our scope, probably working with the mayor's office to see what that may look like to have this type of appendix. So those were my only 2 things was the charter. being outdated, and then the removal section, seeing since we don't have the power to remove, what does that look like in scope with what we're trying to do with the reasons to removal, if that makes sense. But other than that, I think it looks great. We have been working on that for a long time and trying to align the language and things like that with the charter and the current bylaws and just figuring out our new scope because most of us are considered new to this board. So just really just seeing what our scope is and how we can best function and act out our functions. So that's all.
I think those are perfect questions for us to talk about next week during a working session. Because that probably is a conversation that will take more time than we have in this meeting. But if it works for the rest of the members, I will canvass us all to see when folks might be available next week. And if that means multiple sessions, I am also fine with that. Because I know it might be difficult to find one time when a large portion of our board can meet at the same time. So I will canvass after this meeting, and we can have some more in-depth talks about what is in the bylaws and what needs to be clarified further. Okay. Thanks, everyone. All right. I will turn it back over to Kristen. Thank you.
Thank you, April, so much for that update from the governance committee. I'm just going to share a really brief update for the community engagement meeting and committee. We have been chatting with Shantae, who oversees the community outreach at the Department of Health. And the reason why we kind of connect with Shantae is just to be sure that our efforts are aligned with the city's priorities, the Department of Health priorities, and to support their efforts, especially seeing as though the city does not have any, structural clinics to support city residents. So most recently, we have been discussing the fall season where the city Department of Health focuses in on viral season, of course, and trying to ensure that residents are aware of the ways that they can protect themselves, who is at high risk, where you can go to get vaccinations. Initially, they were discussing doing a vaccine campaign through the fall months to make sure that people had access and understanding of the viruses, especially with the different viruses that have manifested since the top of the year. There was a particular partner that had made outreach about the vaccine campaign that kind of inspired the collaboration, but unfortunately, there has not been a lot more traction on that end of the partner to be able to push that forward. However, the city's work doesn't stop in the midst of, and so they made a pivot. And Shantae, please interrupt at any moment to let me know if I'm misspeaking on behalf of their work. So they made a pivot to do a marketing campaign instead, which I think was really, really incredible. And the team's been working so hard. So what they have developed has been not only if you follow the social medias and if you're on the Board of Health, I hope that you do. They always are posting things probably mostly daily about ways that city residents can protect themselves. They have comms on their Department of Health website of ways that people can get more information about current events as it relates to their health. And so now they'll be adding officially launched, was it last week? Officially launched last week, or was it this last week? They will be launching a series called Epi Minutes, which I think is really, really cool. It's 60 seconds of one of the most high need conversations around public health where they'll have a representative discuss. One of the ones that I saw was around viral illnesses. So they talked about the environmental scan, what they're seeing in the city of incidents. So, flu, for instance, how many are showing up in the city, and how many cases are being reported, what you can do, who's at higher risk, vaccination information. So I think that's really cool, especially with the attention span of community members. 60 seconds, I feel like it's perfect. I feel like it had the priority information embedded in there. So they'll be doing those episodes. I think they launched an initial episode that was about 60 minutes that will discuss what people can expect when the Epi Minute show. So they kind of know like, oh, when I see this, this is what, I can expect to see. In addition to that, they have been launching some other public health service announcements around vaccination testimonials from some staff at the Department of Health, talking about the importance of vaccines, why they get vaccinated, so people can feel more comfortable with vaccination hesitancy and know that they can ask their department representatives for support in understanding how vaccines work or what their risks are when, taking a vaccine. So I think all of those things, especially in video form, can be extremely helpful. They do have some spots on radio stations, potentially working on getting on KMOX and have their partnership with STL TV, obviously, to have commercials and billboards. So you may see some billboards around the city that talks about health benefits and mainly about vaccination during this campaign. So I really thought that was, and then they'll have uploading the videos on the city website as well, so that people have multiple avenues of access. Shantae was talking about other comms ways where people can reach the information is like putting the video in the signature of their email. So, no matter who their email, it's spreading the word. So I thought that was really great. The videos look awesome. We were planning to show them during the board meeting, but considering time, we'll probably just put them in the chat. And then you all can review them, and I'm happy to send them out as well as a post correspondence after this meeting so that you all can see the great work that they're doing. They're also working on some other cool stuff. Their plans with all those comms things is also to translate those marketing materials into Spanish and Vietnamese, because those are two high populations in the city that they also want to make sure that they reach. And then in terms of the vaccination campaign, they're currently having very early conversations around partnering with St. Louis Public School District to see if there's a request and need that they can support elementary school who may need to be vaccinated, and working through their partnership with Affinia to make those things happen per request if that request comes up. And I think in the interim, one of my suggestions to the team would be, we know that Affinia Mobile Vaccination Clinic is out in the community quite often. And so maybe just getting a list from the director at Affinia to see where they'll be, and then also being able to kind of publicize that to, city residents, so they'll know, like, while it may not be an event exclusively orchestrated by the Department of Health, that these are ways and places that people can get vaccinated when they need to. I know Affinia has some walk-in clinic hours, I believe on Wednesday. Dr. Tapey, you can correct me if I'm wrong about that, where people can go and get vaccinated. I think the only other new updates is that they're not stopping with their marketing comms campaign. They are planning on doing a series of A Day in the Life, where they'll be showing different people that work in the Department of Health to show their role and what that looks like. I know that previously there's been discussion about some city residents not being fully sure of what the Department of Health offers. And I think doing that comes alongside it, like, well, here's what I do, in public, not public safety, but here's what I do in environmental, safety. I'm probably saying the department's wrong, but just to show the scope of their work so people know how to engage with them when it comes to things that they need, water sanitation, lead level checks or house lead checks and things like that. So I thought that was pretty cool, because that may help the residents understand how they can partner with, coordinate with, and receive services that are existing from the City Department of Health. And that is mostly the update that we have from community engagement. Is really exciting things. And I'll take a moment to pause to see if Shantae wanted to add anything additional before I close out.
Thanks, Kristen. I'm going to yield to the commissioner, because I think she's going to be sharing some additional insights as it relates to our outreach. But I am very proud of our work, very excited to get the messaging out for this year's respiratory illness season, and definitely very appreciative of the support that we get from our board. We have an amazing board, so I thank you.
Thank you, Shantae. All right, without further ado, I'm going to turn this over to Imbal to give an update on the Academic Partnerships Committee.
Hi, a truly quick update. Not making fun of you, Kristen. As we met last month, and Morgan, I'm going to put you on the spot for a moment. We had this great meeting, and the idea of pulling together a conference came up, and Morgan put in a letter of intent to PCORI for Morgan. Please, you need to speak. I'll stop.
It was a letter of intent for a one-year grant in the amount of, I believe, $150,000, which would fund a convening where we would bring together academics, community partners, community members. PCORI is really focused on patient-centered care. So the emphasis would be on patients, which, I know the Department of Public Health spans prevention and treatment. So I think the emphasis would be more on trying to develop research projects focused maybe more on the treatment side.
Great. Thank you, Morgan. We really appreciate that collective effort. I think the group is motivated and pushed in new ways, which I think is great. The other piece is that thanks to Chris reminding us that we should bring in Lindenwood and his connection. So we brought in Lindenwood. So now we have representation from Lindenwood and UMSL and SLU and WashU. And I think that's it for now. If I forgot, it's not intentional, I apologize.
And I can just add, the emphasis would be on maternal and child health, behavioral health, and infectious diseases. And then I think within behavioral health, we propose to focus on violence prevention. So there is some prevention in there, but I actually think the focus might be on victims of violence. So there's the patient piece. But I'll let people know if we get chosen to submit the full proposal.
Yeah. It's a continuum. I just have to add this to Morgan's, this is patient-centered, but I think the work of public health agencies are really focused on doing all of these things. So I think that it's a nice complement to the work of a partnership of the subcommittee. So I think that was a big success already, and bringing in another partner, we're still we're collecting and creating a database of internship opportunities, and to Victoria's, the commissioner's point, making sure that it is matching, and we're really trying to bring together best practices to really strengthen what students can experience, faculty can support, and what the public health department needs. And that's it for me, for us. If I missed anything, someone tell me. Thank you.
That is fantastic. I think it just really shows the power of the partnerships that you all are helping to support public health with. This is exactly what we have been talking about the past, several months. So thank you so much for all of the work that you all have been doing to make sure that the charge for the Academic Public Health Partnership was clear.
And before we close out, we kind of just added advocacy as an ongoing option, but it may not be every month that we have a robust update. In this case, we did not do any public comments thus far in the month of October. However, the last public reading that we had from our stance from public health funding, Brittany Jones represented us at a public comment hearing in person. And then prior to that, I had submitted our letter to the Board of Aldermen's office, and they had confirmed weeks later that they had received it and it would be put into public record. And so we'll just always try to see when we can hear in advance of times where we can advocate for public health funding. Sometimes those opportunities come very quick. And I know that we always may not be available to be in person. As we continue to do our work, I'll try to always take notes on how the priorities may shift and have some kind of draft of a letter in standing so that if we have to act fast, that we can quickly review something and get something out there just to show our stance as a board. And know that, when we do advocacy work, it is as a representative, but so far this board has been so amazing. We have done it as a collective force, which I think empowers our voice and our support of the Department of Health and their work. And before I close out for the committee updates, thank you all for doing the survey. We are trying to work towards getting like some sort of, as we call it, a task force together so that we can have more and deeper conversations about the work that each committee is doing. And so that it's just some synergy and maybe advice sharing and brainstorming that could happen as a collective, where this meeting is currently isn't structured in a way for us to have those nuanced conversations, but I know how those conversations can be clarifying. And so right now, as it stands, most board members have selected Tuesday afternoons to be the time where most people are available. If you want to reach out to me, if that's a time of conflict for you, please let me know. Otherwise, we probably will go with what majority selects and do something. We can talk about if we record something or we send out a one-pager if you happen to miss it, or April and I can plan to have a one-on-one to update you if that's something that you would like to have so that you're updated and have clarity around the projects that we're doing as a board. Are there any questions for board committee updates before I turn it over back to April so we can hear from Commissioner Victoria Angwari? Okay.
All right.
you
Thank
all.
you. Thank you, everyone, for all of the work that you have been leading and doing to support public health. All right. Our next agenda item, Commissioner, you are up.
Good morning, everyone. I just want to do a time check. I'll be speaking for, well, my time slot is about 10 minutes so that we don't go over for the mayor. And I'll try to save some time for questions from my presentation. So this quarter, we have exceeded many of our benchmarks. You will see that in the report, which will be sent out. We've also developed strategies for areas that need improvement. This year's quality improvement training cohort is currently in the process of addressing some of these challenges related to on-time food and beverage inspections and other areas. So I'm excited to be able to provide an updates further as they finish their work and put it into practice. I'll just go through a few of our focus areas, pulling out key highlights in the interest of time. Over the third quarter, our HIV teams achieved significant success, highlighted by their first sponsorship of FrizFest, which yielded strong engagement with 30 individuals testing positives for HIV and being connected to care, and over 400 safe sex giveaways distributed. The Health Stop team continues to expand and its reach and visibility in the community. I'm so excited to announce that our Family, Community, and School Health program has finally gotten their MOU with SLPS, St. Louis Public Schools, finalized. And so that's opening up new opportunities for collaboration around school age vaccination and lead screening and things like that. So really excited about that. Our behavioral health team is also looking to partner with SLPS through the same MOU around mental health education within the school. So this is a new conversation that we're looking forward to expanding. Let's see. And then I do want to show some of the videos that, as we move from summer and begin the long stretch of respiratory illness and cold weather, we want to, as Kristen mentioned, we have been busy, our communications team has been busy working on outreach to create new assets like brochures, billboards, metro signs, social media options, and we've begun to translate these into Spanish, many other languages, including Spanish and Vietnamese. And we're going to be expanding these opportunities in the future. Before you share, Shante, let me just go over a few more highlights. So you can have context. So the team successfully completed the respiratory illness campaign called A Healthy St. Louis Starts With You. It encourages individuals to stay up to date on their vaccinations, practice safe hygiene, and seek information from trusted resources. In support of this initiative, the team also developed testimonials, visuals to accompany the campaign, which promotes ongoing and planned through the fall and winter and in the early spring. As Kristen mentioned, we've developed an Epi Minute, which is a new public health education series designed to share timely information from the department's epidemiologists. I will say Shantae's team has been very, very creative this year. I'm so proud of the new work that they've been doing. This is very, very exciting. And the Epi Minute, the first one is focused on respiratory illness, as obviously that's the time we're in, but it will, in future episodes, will include information about all of our disease areas that we focus on. And then in addition to this campaign work, the team provided community communications and outreach support for several major community events. As the summertime winds down, these community events will get fewer and far between. So it's really a good opportunity for us to be out in the community. So our events included the Urban Leagues of Metropolitan St. Louis, Health and Housing Expo, which as this year was very, very important as individuals are who were impacted by the tornado are looking for housing resources and in preparation for the cold weather. We reached over 100 residents at that event. And then there were a few other things that we did this summer that were really impactful. So let me have Shante pull up one of our, I think you're gonna do a radio spot.
So I think what I'd like to do is go ahead and show the PSA that will be airing on local television, and also the language will be used over the radio as well, or the audio will be shared over the radio. And this is the very first one that's already out. So I will do that now. See if you guys can, and can you guys see that?
We can't hear it.
Oh goodness. Okay, I'm going to stop sharing. Apologies for the delay. Share screen, share sound. We're going to try this again. Any luck?
If you can go, we still can't hear it.
Okay.
Why don't you do the Epi Minute and then
Sure. All right, so let's do the Epi Minute. I apologize, everybody. Sharing sound. And I will play it now.
Hi, I'm Dr. James Alex Plurad, an epidemiologist with the City of St. Louis Department of Health. Welcome to our new public health series, Epi Minute, designed to share timely information with the community. In each installment, we will highlight current health data trends, explain what the numbers mean, and share how they may affect you and your family. Our focus will begin with respiratory illness season, and that includes flu, COVID-19, and RSV, viruses that tend to increase during the fall and winter months. We will take a closer look at what we are seeing locally and how these illnesses are shaping community health here in St. Louis. For now, we recommend to do the following: wash your hands often, cover your coughs and sneezes, stay home if you're sick or at least wear a mask at work, and get your seasonal vaccines. That's the idea behind Epi Minute. Clear, reliable updates that help keep our community informed, safe, and healthy. Thanks for tuning in, and we look forward to continuing to share information that supports a healthy St. Louis.
You can always find more information at stlouis-mo.gov/health.
Okay.
that's one. Were you able to get the other one working?
Let me see if I can. I'm trying to get this out really quick. I do apologize to the board and to our honorable mayor about this. Let me see if I can get it to go one more time. And I'm not really sure. Oh my goodness, this is so embarrassing. I got it. Here we go.
Started from the beginning.
I am. All right, here we go, people. Just making sure everybody's on their toes. Let's do it. Can you see it?
No.
All right. Let me share now. And let's go.
Don't let a respiratory virus get you down this year.
Started from the beginning.
Where we see an increase in virus. Hey, St. Louis, don't let a respiratory virus get you down this year. It's that time of year where we see an increase in viruses like RSV, the flu, and COVID-19. The good news is there are steps we can take to protect ourselves from getting sick, missing work, and a possible hospital stay. Be sure to wash your hands frequently. Stay home when you're sick. Get your vaccines and access information from trusted sources. Remember, a healthy St. Louis starts with you. Visit the City of St. Louis Department of Health website at stlouis-mo.gov/vaccines to find out where you can get vaccinated and avoid RSV, the flu, and COVID-19.
Okay, it took a few tries, but we made it. We made it. And if you don't mind, just really quickly, I just wanted to share a couple of things. I wanted to note that usually I leave these things as far as sharing to the experts. So that's why we have the difficulties. That's one thing. Also, we are getting these videos and audios translated into Spanish and Vietnamese as well. We are being very intentional across the board on making sure that we reach as many people in our community at large during this season. And so be looking out for those as well. And then the billboards that we have also been translated. So we will see out in the community the billboards translated in those languages, and we were really intentional using data and insights from the STL TV and our other partners to ensure that they were strategically placed. So we're looking forward to being able to measure the traffic, the level of traffic that we get. In terms of people reaching out for vaccinations and for additional information, but really excited about this respiratory illness season. And that's all we have.
Great, thank you, Shante, and I'll yield back to April as we're at time.
Thank you so much. That was fantastic, and I just really love the quality and the thoughtfulness that the outreach team always puts into what they are sharing. All right. We are here. Everyone's excited about this next moment in our meeting. We will welcome members of the mayor's staff and also the Honorable Mayor of the City of St. Louis, Kara Spencer, to our meeting. Last week, based on the feedback from members of the board, Kristen shared the list of questions that we would like to hear more about. And so we look forward to hearing from the mayor about those items, and then also leaving some time so that we can have some question and answer afterwards. So I will allow first, I think, members of the team, of the mayor's team, to introduce themselves, and then perhaps Claire, you can introduce the mayor.
Sure, of course. Good morning, everyone. Thanks for having us here today. I know a couple of you, appointed a few of you, met a few of you, talked to a lot of you on the phone, so it's good to put a face to a name. My name is Claire Sappa. I work for Mayor Kara Spencer as head of civic participation, and I was hired about 3 months ago, so fairly new to the role, but jumped in, hit the ground running. Been working with all the boards, 145 boards and commissions for the city, making appointments talking to everyone, making sure people are aware about every single board and commission, trying to increase participation. So I'm always here to answer any questions, help direct you to where your question can be answered. Yeah, so I mainly focus on boards and commissions, and then as my scope kind of expands, as I get a little bit more familiar with the role, I'll be more out in the community. So happy to answer any questions. I know also my colleague Ben Johnson, Colonel Ben Johnson is on, but I think maybe he might be need to be allowed to speak as a panelist. April, if you can.
I believe that our friends at STL TV might need to send
Okay.
a panelist link.
So yes, I'll turn it over to Ben. He also started the same day as me. Ben, if you want to introduce yourself from the mayor's staff.
So I don't think, if Ben is not on this side of it, he may not be able to.
Okay.
He's on the
Well,
audio
then,
side. Yeah.
Ben is our Chief Operating Officer. I will just turn it over to Mayor Spencer, who I just saw her pop on. So Mayor, welcome.
Thank you so much, Claire. And I'm happy to be here this morning, although I am sad to be tuning in from my phone. I was having difficulty getting on through my computer here this morning. So I hope you can hear me okay and see me despite my camera phone being the entity that's transmitting me here this morning. But I was excited to listen to the meeting this morning. I've worked with the Joint Board of Health and Hospitals before in my capacity as an alderman. Public health, is so important to our community. And so I'm grateful for the opportunity to talk with you all today. And as a sidebar, Ben Johnson has walked into my office. And so I couldn't talk. He was unable to talk from his. So then I was having difficulty logging in from my computer. So I'm logged in from my phone. So I could actually just hand you my phone.
It's all right. I'll pitch in as you need me.
Okay, great. So we understand that you have some questions for me. I'm happy to dive into them if that is what the board would like to do next.
Yes. Happy to dive into the questions. Claire, were you going to say something?
No, I was just going to make sure that we were going to move on to the question section.
Perfect. So we have about 7 questions total, hopefully leaving time at the end for some Q&A depending on how the questions are answered. We've prioritized 4 questions that we'll ask first. And the first question is, what are your top priorities for the Department of Health for the city of St. Louis?
Yeah, is that better? Okay. My top priority, I was just putting it on speakerphone here, so my apologies here. My top priorities for the Department of Health. Well, I would say, first of all, and I didn't have the opportunity to say this at the beginning as we were kind of shifting here, but I know that you all are volunteers here serving in the capacity here that you're serving. And so first and foremost, thank you. I know each and every one of you has a commitment to public health, and the time that you're dedicating to serving on this board is important and impactful, and will hopefully help not only me achieve the goals I have for public health and the Department of Health, but help shape additional aspects and additional work products that we're working on. My administration is really interested in supporting the core public health functions that improve health and safety for city residents, with, of course, a focus on our most vulnerable populations. This is in line with the work I've done as an alderperson over my last 10 years of service. So I would say that, one of the areas that's really important as a focus for me is increasing childhood vaccination rates. I was really encouraged and excited to hear earlier in the meeting the public awareness campaign, the billboards, the personal stories about vaccinations, recognizing how low our vaccination rates are in St. Louis. That's an enormous public health concern, and one that my administration is focused on. I've also focused over many years on areas of public health disparities, including lead contamination. We have still an enormous issue with contamination in our city's children, particularly those under the age of 5. And as we look forward to the coming months and years, I'd like to coordinate better our public health department with our building division, which oversees our lead program. We actually have quite a bit of funding that I know could be much more efficiently and effectively putting towards lead remediation in our housing stock. I've also worked in the past on areas of asthma. It's a huge issue in many of our communities, particularly our most vulnerable communities. And so, especially as we're looking at the federal government pulling back on air quality standards, I want to make sure that our city is doing everything we can to protect our communities. I'll also say that the sexually transmitted infection rate is still alarmingly high in St. Louis. And so screening and education, both through the Department of Health's Health Stop Clinic, but the outreach that the department does is phenomenal. But I want to continue to support that and increase the effectiveness of that. These are all areas that our outcomes are measurable. And so as we move through the next few years, we'll be tracking our community and ensuring that the efforts that we're putting forward are effective. But I'll also just kind of add to that as well. The public safety public health within our incarcerated community. Public safety and justice are sort of intertwined in a way. And as you may know, we recently appointed Director Nathan Haywood to oversee our jail facility. And he's hit the ground running, much like Claire and Ben have, and have been has already been working hard at addressing some of the issues that we have in our facility. I neglected to discuss some issues related to the tornado response and recovery, but I do believe you have some questions related to that later that I could kind of maybe focus on that area.
Okay, thank you. Thank you so much. I will move to the next question if you feel ready for the next question. How can you see the Joint Board of Health and Hospitals best support your administration's health-related goals?
Well, there's lots of ways. I'd like to actually lean onto the board for some guidance on how you all envision being able to not only support, but help guide our efforts. In the past, I worked very directly with Dr. Will Ross when he was the chair to implement an air quality control monitoring bill at the Board of Aldermen as an alderman. That was in response to the Ferguson report at the time. Excuse me, not the Ferguson report, the Racial Equity Indicators report, which identified asthma as the largest area for need of improvement with regards to racial equity indicators. And so, I worked hand in hand with Dr. Ross to implement that law that puts some stricter air quality standards in place here locally. So I'll lean into the board here and hopefully be guided in part by you all on areas that you want to see the administration focus on. But I do have no doubt that there's ways in which we can work together to support health-related goals.
Thank you. And I promise I won't do this often, but I did just want to ask a clarifying question to your response. So your hope is that we can help guide and or suggest opportunities for political advancement that can benefit the city residents from a health perspective.
I don't know
improvement of air quality control or other bills that may be relative to the residents' needs?
Well, those are legislative initiatives, and certainly I think, the mayor's office can be helpful in getting getting any legislative initiatives through the Board of Aldermen. But, I want to continue to lean in, to ways, because many of the members of this board are new, and my role here as mayor in relation to the board is new. I want to hear from you all the areas in which you want to see the city focus. And based on those new relationships, I'm sure that we can find ways in which we can mutually support each other's goals in the health space. I view, hearing this board talk earlier about, or excuse the work that you're doing to promote vaccinations is very helpful. I think, we can collaborate on initiatives like that. I'd love to hear the board's response or reaction to some of my priorities, particularly as it relates to lead. And I think there's a lot of room for improvement on how our city distributes the funding related to lead remediation. I would love to partner with the board on improving confidence in the public in our city's ability to deliver lead remediation into homes. There's a public awareness that we have funding that I think could be very effective. But I think the fear involved in allowing a city inspector into a home is so preventative of that important work. I would love to partner with the board on ways in which we can improve the public's perception of our city departments, improve trust within the public for the work the city does, and improve those outcomes, particularly in our kids.
Thank you so much for that. Moving on to the next question that we have for you. What is your current progress on hiring a new director for the Department of Health?
Our administration is conducting a search. We have been working on this for several months now. So far, we have been provided about 10 to 12 prospective candidates. This was in partnership with some folks in the public sector advisors, Dr. Garza, Dr. Will Ross, and some other folks. Celeste Fossmeyer have been involved. These candidates, some of them have already indicated that they're pursuing other interests or other opportunities, but we are continuing to search for candidates for that role. In fact, this is a great opportunity to make sure that you all know that we would love and appreciate some prospective candidates, some guidance from the board here. We do have the job. The job is that there is an opening, and we are looking for the vision here is the ideal candidate would really bring a strong focus and experience in administering public health. So, we have those issues I discussed earlier, but I would also add behavioral and mental health to those list of issues. So I think, the administrative and management skills are very, very important. Willingness to be flexible and nimble, especially as our federal funding models are shifting so dramatically, those are going to be top priorities for characteristics we're looking for in filling that role. I do have to say our current interim director is doing an excellent job. She has really steadied the ship through the tornado and through the last several months, as we saw Dr. Mahdi exit. And so because of her leadership in that role and the confidence that the team has in her interim role there, it has allowed us some additional time to focus on, hiring somebody, for example, for our jail facility. So as we have now gotten some of those other roles identified, we will be more focusing on our health department. That isn't to say that this hasn't been a priority. It has been. I just want to also point out that we have had a high degree of confidence in the interim director here, and that's allowed us some grace in this role and finding the right person for that role.
Thank you so much. Moving on to the next question. What are your thoughts on stabilizing and increasing funding for the public health efforts in St. Louis City?
Boy, this is a tough one, particularly as we're looking at changing federal funding models. Funding health on the local level becomes challenging, particularly in a state like Missouri, where Missouri, as you all, I'm sure well know, funds health at the bottom of the national list. So we know we're at a disadvantage on many fronts. But what I would say is that my focus here when it comes to stabilizing and increasing funding is really prioritizing and supporting a regional approach, regionalizing the strategy that we have for addressing public health concerns, and sharing resources across the metro area. And I think there's some unique underlying state statutes that could actually allow us to politically align health considerations in a regional basis. These are areas that we're exploring from a policy perspective, but also from an administrative perspective. So I think, as the health funding landscape becomes increasingly unpredictable, really strengthening our regional relationships is going to be key to making sure that we are providing the funding and the resources that we need to our communities here in the St. Louis metropolitan area. Health concerns know no geographical nor political boundaries, of course, and so many of these issues are just borderless here.
All right, thank you for your response on that. So now I'll start to move into the other set of questions, and then there's 3 of those. And if we have time, I would welcome the board members to ask any follow-up questions that they have. What are your thoughts on returning to a model where clinical services offered through the health department, such as reopening public clinics or hospitals in St. Louis?
Well, I very much understand the interest in seeing this, offering direct clinical services, particularly because so many of our neighboring communities do that. St. Louis County provides direct clinical services. The city of St. Louis has rather focused on partnerships, in particular with our federally qualified health centers to deliver those services. We believe in those relationships to provide high quality clinical care, including the, immunizations and preventative services that they provide. Our health department has focused on strengthening those partnerships, but I do think that regionalizing our services and our health resources in general could be a path for being able to offer those direct clinical services. St. Louis County serves a much bigger population, which makes it much more feasible to be able to deliver those. Of course, they have different funding levels, staffing, capacities and things of that nature. So partnering with St. Louis County could be a path for that. I'm open to exploring ways in which we could potentially offer those services. But I also do, recognize that right now, how we're doing that is through those partnerships, those partnership organizations. But I would be open to dialogue and to ideas on ways in which we could re-enter that space more directly.
Thank you. I believe Kristen has had to step out for just a moment, so I will ask the next question. What are your plans to support our neighbors who have unstable housing due to damage that their homes received in May as the winter months come quickly? I'm sure this is also top of mind for you in your office.
It is, thank you. And I'll say too, I mean, the public health, excuse me, of the community that was impacted by the tornado was top of mind right off the beginning, right from the beginning. You may remember or may know that as soon as the tornado struck, we were very worried about things like tornado lung. This was something that swept through Joplin after the tornado there, and actually resulted in loss of life for several folks, many months after the tornado. And so immediately we brought in Dr. Garza, who had been really instrumental in helping lead the St. Louis region through the COVID-19 epidemic, to help provide some outside perspective, of course, leaning into our health department here as well, but just trying to make sure that we were doing everything we could to understand the risks that residents were experiencing immediately, and to mitigate and communicate effectively what folks could and should be doing to protect themselves. We were also monitoring the air and other things like that. But your question was really around what we're doing to provide housing going into the winter months here. So we have been working on a regular weekly basis with our Department of Human Services, along with the health department, and there are many other departments involved in these conversations, including SLDC and CDA, as well as many community agencies. We've stood up the Office of the Tornado Recovery here within the mayor's office. Julia Nix is leading that effort. And we are really focused right now on ensuring two things, especially as it relates to housing in vulnerabilities. One, that we're providing that we have a plan in place for what are considered the traditionally unhoused. So the region has a population of folks that are unhoused every year. And we're working to improve the ways in which we have we are addressing those needs during this winter. We're also accounting for the many, potentially thousands of folks that are going to be unhoused, are extremely housing vulnerable during the next few months as the result of damage to their homes. We know people have been sheltering within very, very damaged buildings, which can be feasible, albeit extremely uncomfortable during summer months, but becomes dangerous, if you don't have a roof or windows to live through the winter when temperatures become dangerous. So we're doing a few things. We expanded the eligibility of the Impacted Tenants Fund. We reappropriated about $10 million in total for emergency home repair. And that those funds are getting out the door now. We're trying to get as many funds out the door for the emergency housing repair as possible before the winter months set in, so that we can make housing units livable through the winter. And we're also doing some additional, those were the community development block grant funds. We also have community partners who we're working with to distribute funds to repair homes. We're also going to be expanding the shelter space throughout not just the tornado zone, but throughout the city. And we're standing up warming shelters within the tornado zone so that folks can leave their homes and be warmed and be able to go back into their homes during that time. So we're looking to roughly double the capacity of the sort of immediate shelter space, and standing up additional warming shelters throughout the city as key components to making sure that we have life-saving resources on hand during the winter months here ahead.
Thank you so much, Mayor Spencer. I wanted to clarify the fund that was that the eligibility was being expanded for. Could you repeat that fund?
That was the Impacted Tenants Fund. So we expanded the eligibility to include tornado impacted tenants. But we also have additional funds for relocation. FEMA, one of the areas we really focused on, I mean, we've been focusing tirelessly on is getting the federal funding for tornado victims. We have, despite the tumultuous national environment, federal environment, gotten some key support systems. One is the individual support to tornado victims. FEMA has distributed well over $40 million direct to residents at this time, and they are continuing to support tornado victims through rental assistance for up to 18 months ahead. That's important because it is rehousing a lot of our residents. We've also received $100 million from Governor Kehoe in the state of Missouri and roughly $200 million for debris removal. That doesn't help house folks now, but it does help make sure that the city has the funds it needs to do the debris removal so we can continue to support other housing efforts.
Thank you so much. And then the final structured question that we have is, before we go into Q&A, is how is your office working to align the efforts of the Department of Health with other city-led initiatives that address the social determinants of health, such as housing, public safety, and justice-related systems like the City Justice Center to improve overall community well-being? I know that's a long question. So.
It is a long question. It's also, fairly complicated. I mentioned a little bit earlier about, the health department better aligning, or maybe the building division better aligning with the health department on outcomes such as lead contamination in our city's children. We do know that we've been siloed for far too long in our region, but also in our city departments. Under Ben Johnson, our departments are going to be moving from a monthly cabinet meeting to increasing frequency to better align departments and better align goals and better track outcomes. And I think that is I'm confident that's a move that's going to be able to improve the collaboration between the operational departments in our city. The Department of Health is an outlier in some regards in that it is a great collaborator with other departments. I think in general, the health department is the department that's always willing to partner up with the NSOs, the neighborhood stabilization, and the fire department, and really be present in community in very, very meaningful ways. And we're looking to strengthening that from the perspective of other departments, leaning in on the Department of Health, among other departments, to better align all of our city's goals.
Okay, thank you for your response. So now, if you don't mind, we'll open it up for board members to ask any follow-up questions.
Oh, you do? Okay, thanks, Ben. Sure. Say that again.
We'll open it up to board members to be able to ask questions that they had that didn't get asked. And then if there are additional questions I wanted to ask, could we send those as well for you to have a response to if we don't get to all the things board members have on their minds?
Sure, I'd be happy to.
Okay, thank you. Any board members have any follow-up questions they would like to raise with Mayor Spencer?
Yeah, I have a quick question. Thank you so much, Mayor Spencer, for taking the time to meet with us and hearing your thoughts on the questions that we posed. And I love the dialogue too, going back and forth. But I would definitely like to ask, I know you talked about us, being more aligned together and collaborative together. What would be the best way? I know we only have a certain amount of time right now to talk, but what does that look like going forward, for follow-up meetings for us to build on what we discussed today and explore, ways that we can work together in advancing the health here in the city.
I believe this is Dr. Daly.
Yep.
Okay, thank you for the question. I think, I think the most effective way to do that would really be to, if the board could align to some extent on the goals of the board. And then following that, once there's an agreed upon set of goals or outcomes or objectives, set a meeting with myself and my office to talk about how we can align those and where the priorities of the board align with what we're doing and what we can focus on in the coming year or years ahead. And that will give us some agreed upon shared goals and objectives. And I think I'm confident we can come up with some ways in which those really overlap. But if the board could do some of the work of identifying, of having those conversations and aligning on what the goals and objectives is, that would be a very helpful first step.
Awesome. Thank you.
Thank you, Dr. Daly. Thank you, Mayor Spencer. Any other board members have any follow-up questions they would like to ask?
Hey, good morning. This is Ben Johnson. I obviously am not a board member, but I did want to just offer a quick introduction if that's appropriate at this time.
Absolutely.
Okay. Looks like I don't know if the video needs to be enabled as well, but we have this great fuzzy picture representing my likeness. It might be better. I just wanted to thank the board as well as follow up on Mayor Spencer's comment about the work that she's tasked me to do to collaborate more effectively and bring our departments together to achieve meaningful progress on meaningful timelines. And just as an example, yesterday, Commissioner Anwari and I were meeting with 13 other departments or agencies that are operationally focused that do impact those daily indicators or factors for public health, and collaborating on just key issues across the city, that just the day-to-day operations and the challenges that we face, just based on whether it's the time of year or specifically as we think about going into winter, as was just discussed. So that is on a biweekly basis right now, in addition to our cabinet meetings, which will include even about double that number of departments and agencies. And so that's one of the ways that we're tackling it. Like Claire said, I joined the same day Claire Sappa did, so you heard from her a little earlier. So just about 3 months here, but we have really taken on the mayor's charge to really aggressively collaborate and establish measures of performance and success, and hold ourselves accountable to those. And so we'll start to, as that frequency increases and our metrics become more clear, we're actually having a meeting with the mayor tomorrow on some of those metrics. Eventually, I would say in the coming months, we'll be communicating those more to the public as well. So that's really all I hope to communicate. And, if you have any questions for me, I'm available as well.
Thank you so much, Mr. Johnson, for introducing yourself and sharing that information. Any of Imbal?
I just wanted to, is it okay to ask a question?
Absolutely.
Okay. Hi, thank you so much for coming and talking with us. I'm Imbal Shakam, professor of public health at St. Louis University. And so Mayor Spencer, you talked about, it's one of my favorite topics, thinking about no boundaries. Health knows no boundaries, infections know no boundaries, but general like air quality also. Could you talk a little bit more about those kinds of, I know as a Board of Health of the city of St. Louis, I'm not thinking about that, but I am considering how can we advocate and think through some of those regional challenges, and who should we be collaborating as a board as well as supporting that effort for you?
Yeah, I mean, one of the biggest challenges we have right now as far as air quality goes is our friends across the river in Illinois, in particular in Sauget. The contamination that's coming in from Illinois is significant. I know from a personal experience, living along the route of that air is really, really a challenge, but it is Also as we look at, our permitting process, particularly along the riverfront, what that looks like as far as air quality. I'm deeply familiar with the environmental law clinic's work and the lawsuit that was filed with the Dutchtown South Community Corporation as it relates to air quality, because those impacts are real and they typically do impact our communities of color and lower income communities phenomenally higher rates. So that is a true way in which we could collaborate regionally. I think of East West Gateway, and they are keeping tabs of these things as well. I'm impressed and encouraged that East West Gateway has taken on homelessness as well as violence prevention. Those two areas, they have really started the regional conversation about as well. I think air quality, I would add water quality, those are equally important considerations, particularly as St. Louis is a bi-state area. That we should be considering having some true regional conversation around. Water, I would add to that because it is going to be one of the most vulnerable but valuable commodities that we have in our region, but as a society here in the next coming decades.
Yeah, thank you.
Critical to our health. We didn't talk about this, but I will add as well on the public health side of things, something that Ben Johnson has really been leading on is our refuse and improving the trash collection. That effort cannot be understood, the importance of which cannot be understated. We are vastly improving the ways in which we're removing garbage from our community. And that is going to have tremendous health impacts. We have a huge problem with rodents throughout our community, throughout our city. And that work is really, really important, especially as we think about the communicable diseases and other things of that nature. So the focus on the operational excellence has real health impacts as well.
Sure. Thank you, both Inbal for your question and Mayor Spencer for your response and additional insights around the trash collection in the city. I had a quick question around just something I'm thinking about is who you all consider as city government priority departments that support the tornado response efforts. I hear a lot about building division, and while I think that is critically important, obviously, because we're talking about infrastructure, I think oftentimes there's this underrepresented understanding that the impacts of public health very broadly, from the individual that's impacted to the person that's servicing the community as well. And so I'm curious with some of the funding streams, which I know, while not robust, how are those also being appropriated to support the department's, the health department's effectiveness and their outreach with community that then can be done in partnership with some of the other departments in the season post-tornado, right?
Well, the role that the health department has played thus far can't be understated. I mean, they have been integrally involved in our planning and all of our work up to this point, and will continue to play a very, very important role. The tornado funding has not gone into funding departments. Building division or otherwise at this point. We have stood up our own department, small department, but very robust department of tornado recovery. We've housed it in the mayor's office just because it kind of transcends all offices, and we had to put it in a temporary spot. We decided we really wanted to cram an additional 8 people into this office space here. I'm kind of kidding, but yesterday, this week was moving day, so we're all kind of packed in here like sardines in some regards. But they are really trying to coordinate and support departments. We don't have we didn't get a big tornado chunk of money per se. So there's no additional real funding other than what we're hoping to get reimbursed by FEMA from. We have submitted, with the help of our department leads, including our health department, some significant costs associated with the tornado that we're hoping get reimbursed. But again, the federal government isn't even working today. So there's a large amount of unknown here. Typically, when disasters happen, FEMA shows up and runs the disaster and really helps to support through direct aid to the public entities right off the bat. We didn't get that. That was not the case here. That is not the case with the federal government currently speaking. So we have been at a true disadvantage in that regard, but we are hopeful that we'll get some reimbursement and that we can continue but we do know, regardless of that, we are operating in a way that's funded through the RAMS funds, and we know that we can continue to support our tornado victims on the local level with what we do have so far from the federal funds.
Thank you so much for your response. I know we have about 2 minutes. Does anybody have
Yes,
any
I
quick
was actually going to recommend that at this point, now we have one minute left, that any unasked questions we gather from members of the board and then share with Mayor Spencer after this meeting. And because we're not going to be able to get to the announcements, we can follow up with the board via email with those two. So just wanted to again thank you, Mayor Spencer, for coming to this meeting. We are really focused on establishing a relationship and not just being but this is hopefully not going to be a one and done. So thank you for being gracious and for offering to interact with us in various ways moving forward. So you can expect to hear from us again. I want to thank all the members of the board too, because there's been a lot of work around cultivating that list of questions and paring it down. So that being said, we have reached our time. You all will be hearing from me and Kristen about your unasked questions and also about a couple other matters regarding the bylaws and an upcoming meeting that we may have in person. Okay? All right. Well, I'm going to formally adjourn us. It is 9:30. So we want to start on time and end on time. Again, thank you so much to the mayor's staff. It was really lovely meeting you all.